Do you know what causes diabetes? Well, buckle in, as we're about to take a deep dive into this often misunderstood condition. Diabetes, in a nutshell, is a chronic health condition that affects how your body turns food into energy. Most of the food we eat is broken down into glucose and released into our bloodstream. Our pancreas then produces insulin to allow glucose to enter our cells and be used for energy. But here's the catch. In people with diabetes, this system doesn't work as it should. The body either doesn't produce enough insulin or it can't use it effectively. This leads to high blood sugar levels, which can cause health problems if left untreated. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Each type represents a different glitch in the insulin-glucose interaction. Understanding what diabetes is the first step towards prevention and management. Now, let's delve deeper into the causes. So, what exactly causes diabetes? The answer is not as simple as you might think. There are several types of diabetes, each with unique causes. Let's dive into it. Type 1 diabetes, often developing in childhood, is typically genetic. It occurs when the immune system, in a case of mistaken identity, attacks the insulin-producing cells in the pancreas. This leaves the body unable to produce insulin, a hormone essential for regulating blood sugar. On the other hand, type 2 diabetes, the most common form, is often linked to lifestyle factors. Obesity and lack of physical activity can increase insulin resistance, where the body doesn't use insulin properly. This leads to an overproduction of insulin, which over time results in the pancreas losing its ability to produce this vital hormone. And then there's gestational diabetes. This temporary condition occurs during pregnancy due to hormonal changes that increase insulin resistance. As you can see, the causes of diabetes are varied, but the good news is there are ways to prevent it. Did you know that certain lifestyle changes can significantly reduce the risk of developing type 2 diabetes? Indeed, prevention can be as simple as maintaining a healthy weight, committing to regular exercise, and ensuring a balanced diet. These practices help regulate your blood sugar levels, consequently minimizing the strain on your insulin-producing cells. Now, let's talk about risk factors. Firstly, family history plays a significant role. If you have a parent or sibling with type 2 diabetes, your risk increases. Ethnicity is another factor. Individuals of certain ethnic groups, such as African, Hispanic, and South Asian descent, have a higher tendency to develop the condition. Age is also a determinant. The risk increases as one gets older. Lastly, certain health conditions like high blood pressure can make you more susceptible. Remember, knowledge is power. By understanding these risk factors, you can take proactive steps towards prevention. Taking preventive measures can go a long way in keeping diabetes at bay. But what if you've just been diagnosed? A diabetes diagnosis might seem daunting, but it's not a death sentence. In fact, with proper management, you can lead a normal life. It's essential to understand that regular monitoring is key to living with diabetes. Keep a close watch on your blood sugar levels and adhere strictly to your prescribed medication. Lifestyle changes, too, are vital. Regular exercise and a balanced diet can make a world of difference. Remember, skipping meals is not recommended as it can lead to sudden drops or spikes in blood sugar levels. But what happens if diabetes is left unattended? The complications are severe. It can lead to heart disease, kidney damage, even vision loss. It's not just about managing a condition, it's about protecting your overall health. While managing diabetes might seem overwhelming, there are natural ways to control your sugar levels. The next chapter will delve into these, so stay tuned for some practical and easy-to-follow advice. Eating the right foods can help keep your blood sugar levels in check. Let's explore some of these. Whole grains like brown rice and oatmeal are full of fiber that slows the release of glucose into your bloodstream, preventing spikes in blood sugar. Lean proteins, such as chicken, fish, and tofu, help to keep you feeling full and can stabilize your blood sugar levels. Certain fruits and vegetables are also great choices for managing diabetes. Berries, cherries, peaches, apricots, apples, oranges, and pears are all high in fiber and low in fat and sodium, making them excellent choices. Vegetables, particularly non-starchy ones like spinach, broccoli, and bell peppers, are low in carbs and high in fiber, helping to control your blood sugar. But remember, everyone's body responds differently to different types of foods and diets, so it's essential to monitor your blood sugar levels and work with your healthcare provider to determine the best dietary choices for you. Remember, understanding diabetes is the first step towards managing it. So stay informed, stay healthy, and take control of your life.